Alrighty, welcome everyone. Welcome to another event during our Coping and Caring series. This is brought to you by Workwell NYC, and we'll be discussing building your mental health resilience during stressful times. Um, I'd love for you to be able to use this as a reflective opportunity, a meditative experience, to share your questions with us and to learn something new. Uh, Next slide. So my name is Ayana Mbonu. I am the Be Well Program Manager, and I am really excited to be joined by Dr. Rebecca Lynn Walton. She is the Assistant Vice President of Behavioral Health at Health and Hospitals. Before we get really started, I would like to just tell you a little bit about Workwell NYC. We are your worksite wellness program. So we're here to help you live well and work well. Our goal is to create work sites that make it easier for employees to live healthy and active lifestyles. We understand that health is not just the absence of disease. Health is physical, mental, financial, and emotional. And we know that health exists on a spectrum. And we are here for you with health and well-being resources, programs, and supports to help you eat well, be well, and take action to prevent disease no matter where you are on your health journey. So we will get started. So what are our minds on look like under stress? So we know that everyone feels stress from time to time. Stress is how the brain reacts to and responds to demands. And so what do demands look like? Demands are the demands that we have for work, for school, major life changes, and these demands can be very stressful at times. Stress affects everyone across the board. So some people cope well with it, some people rebound quicker from stress than others, but we all experience stress in some way or form. And not all stress is bad. Some can be motivating. So say for instance, you have a particular project at work that's really important to you, and you're feeling a lot of emotions around it, and it helps you to be a little bit more organized and meet your deadlines. It can help you to perhaps create a wonderful product and meet your demands. And so it can be motivating, but it also long-term stress can affect your health and harm you in some ways. And so here on the screen, you see mental health challenges, anxiety, stress, and trauma related to COVID-19. I think it's important to explain to you what a mental health challenge is. And so mental health challenges may be experienced by all of us, right? We are not robots, we are human beings. And but it's important to note that it doesn't necessarily refer to an underlying condition or illness, something diagnosable. A mental health challenge can arise at a particularly stressful moment, just like I explained. The trauma that we're all experiencing from COVID-19, no one ever thought in the spring that we'd be here today and not knowing when this is going to end. And so we are all experiencing some sort of stress with this pandemic that we're enduring. And stress also is typically, mental health challenges are typically referred to a time-bound event, right? So perhaps you are a new parent with a new baby, and you're a little bit stressed in the beginning trying to figure out how to care for this child, right? But it's time bound because you'll get the swing and you'll learn how to do it, right? And so uh, so not only mental health challenges are we experiencing, but we're also experiencing physical stresses, right? So perhaps your sleep may be impaired right now because there's you are maybe working a little bit more often because you're working from home, and perhaps your sleep is impaired because you're a parent taking care of a homeschooling child. Perhaps uh, you are increasing your eating habits because you're accessible to the kitchen. I know that I've taken on that COVID-15, but maybe your coping mechanisms that you used in the past have increased. And some people are maybe having that extra glass of wine a little bit more often. And so there are lots of different ways that our bodies and our minds undergo stress. And these are some examples. And so I'll hand it over to Dr. Rebecca Lynn Walton to go over the next slide.
Hi, I'm Rebecca Lynn Walton. I'm an Assistant Vice President in the Office of Behavioral Health, and I'm really just very pleased to be sharing today and to be joining with all of you. So I think the most important thing that I leave out right away whenever I talk about resilience is acknowledging how much I already have and how much people bring to the table that certainly none of us has ever been through a pandemic. Maybe some people have, because we may have frontline responders who responded to the Ebola cases or other pandemics in other settings, but certainly none of us has lived through a worldwide pandemic of this magnitude. That hasn't occurred before. So it's important to remember that a lot of the things that I have from my past are the things that I can use today. And maybe I use them in different ways, like I can't go out to dinner after work with some colleagues and blow off steam or go to a happy hour. And some days I don't want to do a Zoom happy hour because how many Zoom meetings can we do in one day? But I can figure out things that I have done in the past in ways that connected to my inner peace, to external validation and support, and I can figure out how to use that during this time. That, you know, a lot of us come to the work we do in city government because we've been through a lot, and so we want to give back to our communities, and so it's really important to remember that. So I just want to help everyone acknowledge how far they've all come. Everyone here has done so. Everyone's made it this many months into this mess that we're all in. And we've done it by banding together, by taking care of our families, taking care of ourselves. And today is really about figuring out how we can build on our strengths. I encourage everyone to listen to things that they previously haven't enjoyed doing for building their resilience, or if you're not hearing something that you do that really helps you, please share that. A lot of times I sort of grasp onto the things I do that make sense to me and that I can do readily, and I forget about something that works for me may not work for someone else, or something that doesn't work for me works for someone else, or I haven't thought of something. So please chime in and fill us in. If you can go to the next slide, please. So today's topics, and I apologize for the city sound right behind me. I'm near City Hall, so it's quite noisy and exciting. Today we'll answer your questions about coping with stressful and traumatic events, improving your perception of self, that sometimes I can wake up feeling like I can't make it through the day and I'm doing a terrible job. And it's all about acknowledging things I'm doing so that I can remember that I'm actually making it through. And if I'm surviving, that's actually quite strong. So we'll also be identifying opportunities for personal growth and new supports, and building on your strengths and practicing self-care during this new normal that we talked about before. What worked before may not work at all now, or may need to happen in a totally different space, like tiny New York City apartments all on top of one another. And any other related questions or tips you have, please feel free to be part of this. We can't have everyone on the screen, but we can certainly read out what people are saying. So thank you so much, and you can go to the next slide.
I'll need to unmute, right? Sorry about that. So it's discussion time. Everyone is muted. And so please add your questions to the chat section. If you would like to be anonymous, just indicate ask for a friend or share your helpful tips. And so we would love to hear what you would like to learn more about, the way that you've been able to support yourself during this time. I do see that one person mentioned that leaning on tools we use through our life are important. And I just want to echo that, just like Dr. Rebecca Lynn said, that we all have tools. We've gotten this thus far, and it's really important to acknowledge that. And so someone else asked, will you receive this presentation later on? And yes, all of the presentations during the Coping and Caring series. Everyone will receive, everyone that has registered will receive. And so please just go right ahead and ask your questions in the chat section. So someone asked, can you provide tips on taking more frequent breaks during the workday? I set alarms in my calendar and I end up ignoring them and end up working continuously for hours on end. So Rebecca, do you have any tips for someone to keep on top of moving during the day?
I do. On the days I'm home, I'm lucky enough to have a dog who comes and swats me and tells me it's time for a break. So that's useful. Use of animals and family members. On days I'm in the office, I actually I make sure not to have meeting after meeting after meeting. I make sure to have, even if it's like a 15-minute window on my calendar blocked off that no one can schedule me for, then I'm more likely not to just blow through the alert and actually take that break. I also found the Stepwell challenge really helpful because I was trying to get a certain number of steps, so I would work in errands that I could do. And I asked my family, what do you need me to get from the grocery store and things like that to make sure that I would go that day.
Those are great tips. I know for myself, I make sure that I drink a lot of water. So I have to get up and then use the little girls' room often. That's what helps me. My Fitbit, it has a notification, and I hear you. I ignore that notification every hour, but the water really gets me moving. Someone indicated they've been working more in their neighborhood to calm themselves. So that's really awesome. Someone asked a question about sleep. Any tips on dealing with insomnia?
I have a lot. I am a lifelong insomniac, and I come from generations of people who also don't know how to sleep. So the hardest thing on the planet is making sure my bedroom is not a location of Twitter and news right before bed. I break that rule very frequently during other times in the day, but I really try to shut off the TV at least an hour to an hour and a half before I go to sleep. And then I try to just read. I'm a big fan of a Kindle, whatever the one has the background light, because it doesn't interfere with my sleep. And then I really just try to, detective novels are really my favorite thing. What's the opposite of the world now? And then I don't have to learn from it at all. And so I try to read that type of thing afterward. And then I did read a great article the other day. It was talking about if you can't sleep in bed, just get up and go somewhere else in the house, even if you're sitting for a little bit on the couch, or just take a walk to get a glass of water, and something about resetting your body, that can be very helpful. But I'd love to hear if you have tips I didn't mention, or if people want to enter those into the chat box too.
Looks like someone indicates that meditation is helpful to them. Take a meditation break. I must do better with following my reminders. So I think that was during the day, but I know that meditation at night is very helpful. I know that I read something where it said that you can listen to a podcast or an audio book. That can be helpful too, to help you, calm down and relax to go to sleep as well. Maybe journaling might be a great idea. Thinking about the day's events and take them out of your head, literally, and put them down on paper may help to help someone to have a more restful night. Some people are indicating that yoga is helpful to them, and they like watching old television shows. Candlelight, bubble bath before bed. That's wonderful. That's a wonderful idea. And
I
someone
think
also,
yeah. I was just going to say, I think for the insomnia version, sometimes people forget that you could do a little chunk of it. Like I could watch 10 minutes of a show, although TV is really not so good in the middle of the night. But I could listen to a quick guided meditation, or I could take a quick shower. I've done that sometimes when I've been up for hours. I just take a 5-minute shower in super hot water, and that helps. But that we don't have to do it for like another hour.
Well, that was helpful. I know in the do you have any tips for those of us that speak to irate water customers all day? Irate water customers. So someone that is speaking to irate customers every day. And so what kind of tips do you have for them to kind of manage their stressors if people are always coming at them?
That seems really in line with working with behavioral health clinicians too, that I've had. Many of my clients come into my office and have a lot of anxiety and stress and frustration that can often come out toward me. And so something that's really important that we've done in our hospital system is have a staff support hotline so that staff can blow off steam and call during work hours to either, I've done everything from crisis counseling to just hearing someone vent, and then they can sort of leave it there and go home for the day. So that can be helpful. Having peer group, taking those breaks that people mentioned before, and then going and talking to peers if you're either at work or taking a break, to have a non-work Zoom where it's with your colleagues, but you can blow off steam and it's not an actual meeting to accomplish things, can be very helpful.
Mm-hmm. Well, that's wonderful. I know that maybe just having a coworker or a friend that you can call up just, during a 15-minute break that you may have in the middle of the day, like you said, to just blow up some steam. If there's not an actual crisis hotline that's set up for that, you can create that for yourself. So that's a great idea. In the Q&A section, someone asked for tips on stress eating, that how do they get themselves to not eat during stressful times or visit the refrigerator as often. Do you have any tips?
I do, and just had a conversation about this a few days ago with some behavioral health colleagues. So a few tips that work well for people is, there's always that moment when the meal is over, when it feels sad that it's over, and so people want to keep it going. And so having an activity booked right after that time can help people make that change from one activity to the next. And so people sometimes set that up. I know I've worked with people with eating disorders, and so they set that up after breakfast, after lunch, and after dinner. They make sure to have something that they have to go to, so they have to stop eating at a certain time. Also working with nutrition, there's a wealth of resources online, apps, things like that, to help people find more balanced food, because oftentimes if our food isn't balanced enough, we wind up overeating of a certain, it's usually starch. And so there's nutrition, beginning and end points for meals, getting up and doing an activity when you think you're hungry, having some water when you think you're hungry, all of these things, because our brain immediately, when we're tired, frustrated, thirsty, our brain often tells us it's hunger. And so figuring out other things can be really helpful. And then the best thing I ever heard that just kept it so simple for food is that our plate should be half, quarter, quarter. So half vegetable or fruit, quarter protein, quarter starch. And just keeping it that simple in my mind really helps me. I don't know if you have any other tips.
Well, this is something that I struggle with, and so I love the tips that you gave. Water really works for me, so I'm trying to be much more conscious of filling my belly. But we did have a stress eating webinar yesterday. That was part of the Coping and Caring series yesterday, and so probably early next week you'll be able to access all of the webinars that took place during this Coping and Caring series on our website. And so if you have more questions about stress eating, I would say just go to our website and take a look at the different videos of the events that took place in the past. We have a resident nutritionist, and there will be a great event coming up that I'll talk more about later, actually next month, to help with eating and diabetes. So perhaps you can learn some good tips there. Waiting 5 minutes was one of the suggestions that someone else on the chat had. And so someone else asked if we can discuss tactics to best relay to our bosses and supervisors if we're feeling overwhelmed and overworked. That's a good question. How do you express to your boss that you're feeling overwhelmed and overworked?
That's always a tough one. I actually, I try to do as much work as I can to figure ahead of time to figure out, am I overwhelmed because I could be doing things different? And I don't in any way mean that people should not go to their bosses and get help and get support, but I just tend to I like to be very clear on what I need before I go ask for it, because I find that people are more likely to give people the support. When it's clear what people want, you're more likely to get that support. And so I like to figure out what are all the things I could be doing to support myself, and then what are the concrete needs I have in order to be better supported in my work environment. Is it that I would like to schedule meetings in a different way during the day? Is it that I would like to have some more support or different amount of communication about projects or something like that? And then so those kinds of conversations are much more likely to result in getting the help that I need than just having overwhelm. Then again, I don't mind also when my supervisees come to me and just say, I'm overwhelmed, and I'm happy to process that with them, as long as it's during like time that we've come up with. That's the other thing, is having regularly scheduled supervision so that we have this regular conversation going about how things are going. And so then when I bring things up, we have that space to address it rather than in the middle of 5 different projects that are all due that day.
Mm-hmm. Well, that was very helpful. I think trying to help ourselves to just be organized about our work, and actually I think would be helpful as well is just know what you're able to do. Be kind to yourself during this time as well, because we're all working under stressful conditions and under different conditions than ever. Most of us who are working from home never thought we'd ever have this opportunity working for the city. And so there's a lot that we've had to do to kind of pivot and make it work. And so I'm lucky to be in a position where I'm able to have that conversation with my boss. And so I think just being aware of your needs and communicating them best way possible. Because it's all about getting the job done in a meaningful way. And so perhaps it's another question. The issue that we are always on and so wrapped up with a to-do list that never ends. How do you cut through that mental fog stress that is sometimes paralyzing? That's a good question.
Ooh, that's a tough one. I'm the worst person to answer this because I like working all the time. I think it all goes to having concrete things to do outside of work, which used to be much easier. If I had to leave at a certain time to go to a yoga class, then I could do that. These days, there is no yoga studio to go to, but I have set runs and that dog comes in handy because I take her on my runs. And so, you know, having activities that start before work or that end before work and start after work can help with that. Also, being able to say things like, I'm frankly more honest with my colleagues about what's going on. Like, I'll say, like, I'll be in a car for 2 hours, so I won't be so available, whereas I used to just leave and be done. But if I'm more transparent about where I am and what I'm doing, then they sort of know not to reach out, or that they'll just have to wait until I get back in contact and can do it. But yeah, it is hard because hours are so different and things come up at all times of night and day. But then again, my position was always like that. So I was sort of used to doing that. So I think I would love to hear from you because I might not be so good at that one.
Well, for me, I think that having really important boundaries are important, you know, and just understanding what I need to be well. So I may work after my 4:30 hour. I may work till 5:30, but knowing what my boundaries are, knowing what works for me, knowing that what time I need to get my tasks completed is important for me. And understanding that when I turn my computer off, I even move my work phone away so it's just charging. It's not on any kind of notification that I can hear, so that I create a boundary for myself that when work is over for me. But I know what works for me and what what keeps me well during the day. And so that's creating really strict boundaries for myself. I mean, and I do that also with my personal phone. So we are always connected, right? And so now I've chosen to charge my phones in different rooms. And so I know that I'm not going to be disturbed. So I try to create really distinct boundaries when it comes to work and family. And that's my 2 cents. So let's see some more questions. And so I work in several departments, and one department has been giving me a larger amount of work while teleworking. They don't normally mind, but it's a little hard to stay on focus while working from home. And so any suggestions for dealing with the distractions of teleworking to prevent this person from getting really stressed out?
That's a good one. My best tip was coming to the office a few days a week for protected quiet time. I really had to be very strict with those I live with about everyone in their own room, and you do not co-work together in a room. I just find it so difficult. Also, I work really collaboratively, and if someone else is in the room, I'm going to talk to them. And I worked in an open floor plan for many years, and it was great for working collaboratively and exhausting as well. But yeah, I find that separate spaces, even in a tiny New York City apartment, are both possible and essential so that I can be alone to do work and to have, because I am much more distracted when I'm at home versus when I'm in the office.
Mm-hmm. I know something that I did, just like you said, not working in spaces where we share. I have a computer in the dining room, and I was often on that computer. And being in a dining room, you have to pass it to the kitchen. So I've got a lot of traffic. So I decided, the other day to just move to another room where it's just me in the room. So that works for me. I'm lucky in that. So that's what works for me. Just being able to telework and stay focused on my task at hand. Someone mentioned that they have a calendar just for their activities, and they put different activities on their calendar that they want to make sure that they do during the day. And melatonin, going back to sleep, that helps that person manage their chronic insomnia. So I'm not sure how that works, how melatonin works. I know it's a natural.
It does. In all honesty, if people have chronic insomnia, it's not so great just because it can be habit forming and that your body starts to get used to it and it signals to you to go to bed. So people do find after a period of time, it's good for intermittent use. Like if you haven't slept in a few nights and you just need one night of sleep, that's a good idea. But using it over time is not so highly recommended. Acupuncture can be helpful for insomnia. That's something that we use in many of our programs. We provide patients with access to acupuncture in the public hospitals, and then I know there are many clinics throughout the city as well that I believe are open right now. And stretching, someone mentioned yoga, and a lot of people find that intimidating because they think, oh, I have to go do an hour and a half yoga class and have done a training for it. But even if you can look up pre-sleep stretching and things like that, that can really help your body. There's also, I know people have mentioned things about meditation and other things. Oh, and someone mentioned chair yoga. That's really good as well. And so I believe Boston Hospital has a list of COVID resources with little videos people can use. And so we've definitely made that available to our patients as well so that they can access that really nice, snazzy website they have things like how to look at the news less. They have things like meditations to do right before bed, how to know that you have long-lasting symptoms if you have had COVID, things like that.
Mm-hmm. Well, I know that we offer a virtual calendar of different exercise classes throughout the day. So every day of the week, there's either a yoga or meditation. There are actually moving classes. So there's soca dance, there's stretching, there's self-massage. There's all sorts of classes that all city employees are eligible to take part in virtually from home. And so we can, hopefully before the end of this webinar, I'll be able to put the link in the chat section so everyone can take advantage of it. But it's a wonderful program that everyone can take part in, and there's lots of things to choose from. So if you don't like one, you can choose something else, and that will help to break up your day, but also help you with your meditation practices as well. So someone asked a question, what is resiliency?
I think it's important to have our own definitions of everything. So rather than go into sort of what's a scientific definition, I always think of it as, when things are hard, what can I tap into in myself to get me through it? And sometimes it's just, how can I remember going through hard things before so that I can remember that I've made it through hard things and I can make it through this too. And then also knowing the things that I need to do in order to make it through. Mm-hmm. How do you define it?
So I'll give an example. So I was mentioning to you earlier that I have teenage children, and I don't, my children aren't school age, they're not like elementary or middle school age children. But what I find to be resilient for myself is just being able to tackle a stressor that I might have, be able to understand, okay, well, this is a challenge that I have. What can I do to organize my life to make sure that I get through this, right? How can I be able to work towards this challenge and get the results that I want from it, right? And so we've all experienced resiliency in some way or form. We've gotten to November after 7 months of being in a pandemic, right? And so how have we pivoted our lives to make it continue to work, right? And so how have we kept ourselves safe? And so all those internal supports that you have, all those supports that you have from family and friends, those are things that help us to continue to be able to live our lives in a meaningful way. And that's what I think about resiliency. It's not necessarily something tangible. It's an internal supports that we have for ourselves. If that is communicating with your friends on Zoom, picking up the phone and saying, listen, I've had a hard day. And knowing where you need the help and asking for it. That's what resiliency is for me. Someone else says, go ahead.
Well, just one more thing about resilience. I think a lot of times in the trauma world, it wasn't apparent until I got trained in it that resilience actually takes a tremendous amount of support from your community and family. And a lot of times we say things like, oh, children are naturally resistant. No one's really naturally just able to make it through anything all by themselves. We have a tremendous amount of support, of caring, of knowing that we can go somewhere if we're overwhelmed to get additional resources and support. And that really helps us with creating our inner resilience and then keeping it going and building on that too. And so I always try to think of it as resilience is actually a community thing rather than just my responsibility to be resilient all by myself.
Mm-hmm. Mm-hmm. Well, thank you for that. I think that was really an important point to make, because they say it takes a village, but it's not just a village to raise a child. It takes a village and a community just to be well overall. And that's why supportive connections are really so important to our overall well-being. Someone mentioned that resilience is tapping into your own source of strength. Yes, everyone's asking about whether or not this recording will be available later. And yes, it absolutely will be. Someone has taken part in our kickboxing class, and they I guess they want everyone to know that that's maybe a class that we should all participate in. I know there is a boxing class also on Fridays. Maybe someone needs to, get some energy out. So that might be a great way to do it. Someone asked for you to share the Boston Hospital resources. So perhaps later on we can share that information in the follow-up email that everyone will receive. Some things for insomnia. Someone indicated that adult coloring books and reading before bed is something that helps them to relax. And let me just look in the Q&A.
Someone just
Peace.
mentioned something really good that I saw while you were talking. They said crisis counseling is available, but COVID is not going away, but it was seen as a crisis in the beginning. And so I was actually wanting to know from you, how have you shifted over time, how you support folks and sort of how you frame things and think about things in order to provide support through the work you do?
Well, from the work that we do, we really listen to what people at the agencies are asking for and need. And so we have a body of work that we have put together different webinars just like this one around 9 steps, just valuable life. How do you help yourself? How do you look inside and just be aware of yourself, being more attentive to yourself? We had the self-care challenge this summer. And so we have been trying to give information to everyone about self-care, really taking time for themselves right now, being kind to themselves, understanding that this is a new normal, and that what they're feeling is okay. Acknowledging your feelings is important. And just like you said earlier, trying to just be a model for the support and what we would like to encourage in others. And so that's pretty much what we've been trying to offer, and just trying to also offer a vehicle for these conversations to take place so that people have an opportunity to learn from each other. Mm-hmm. And what have you been doing with your staff?
Yeah, so that really resonated, that when this all started, we somehow had this idea that it would be done in a couple months. And so we just needed to sort of push through. And what I love about working in the public hospital systems is this atmosphere of we're all in this together. We're all there to support one another, to support our patients, to support New Yorkers, to make it through this. And I've had to completely re-envision how I make it through, that it is about sometimes slowing down in order to make it through, that my way of working is like you go hard and you do it all and then you're done and you do, but that's not really how to make it through a pandemic. So I've had to it's funny, you tell all your clients and patients about being gentle with themselves, and then you're terrible at it. And so I've actually had to learn, what does it actually look like to be gentle? What does it look like to not have the capacity to finish everything today? I used to be able to remember nothing would slip through my brain. And I would be always like, I remembered to do the thing for Monday on Tuesday and I got it done. But now I forget a lot of things. So I have, because there's a lot going on in our brains right now. And so more lists and more tools for getting through. And then also just acknowledging that we're all doing the best we can and that things are just not as fantastic as they were before. Having compassion for my coworkers when they're not as quick to respond as they used to be has been really important, because then in turn I can be compassionate with myself. And I know this sounds very hokey, but it also is how I've made it through, while also saying I hate things like self-care and I hate the term compassionate with myself, but that's okay too. And just being able to laugh at that with colleagues too.
Mm-hmm. Mm-hmm. We have a question. How do you comfort a family member who's angry and frustrated during this time?
There's a book that I was given when I was learning to be a therapist, and it's called Are You Really Listening? And the entire book, except one chapter at the very end, is basically about all the ways in which we don't listen to other people. And I have found that book to be one of the single most important books of my life, in all my different relationships, whether it's with clients, with family, with colleagues, doesn't matter, with any human on earth. And it's all about, when someone is expressing frustration, we often do things that wind up shutting the individual down, like, sharing my experience, which actually makes them feel like I'm sort of one-upping them, or saying, I would recommend going and reading that book, and we can include that as well in the list of recommendations, because it's been really helpful. That really creating an open atmosphere where it's okay to vent often helps help people deflate the anger and frustration because they're able to get it out, because it feels like they have to hold it all in. And if they can get it out in a healthy way and have a safe place to talk about it, then I find they often walk away a lot more frustrated. Obviously, if it's more serious than that, helping someone identify that they may benefit from help in a loving, supportive way is helpful too.
I really appreciate what you said, Rebecca, because it resonated with me this question, because my daughter is a freshman in college, and she's often I wouldn't say angry, but very emotional about having to be home and not being able to make new friends in school. And so she's a little bit bitey, and responding, the quick responses sometimes. And so I just have to take a step back sometimes and breathe and understand that her emotions are not targeted towards me, and that I don't have to. It's an uncomfortable situation for me, but I can be relaxing and model what I'd like for her to be able to do for herself, and be that listening ear for her to hear what's really going on, because I know that it's not normal, the way that she reacts to me. And so if it's a loved one, of course, maybe we can, like you said, just be a little bit more open and listen to them and provide a space for them to just really talk about what's going on, what's got them feeling that way. So if you can just repeat the name of that book, that would be great.
Are You Really Listening? It is just a really good book. There's a few books that you read as a beginning therapist that just carry into your entire life. I did know someone was mentioning that, what about family members with angry outbursts? And I think that really crosses into something a little more than just providing space for someone to, that really gets into. So the first thing to know is it always needs to feel safe at home. And if it's not feeling safe, to definitely reach out. You have the folks on this phone call who are part of the EAP program and work well as part of the OLR office. And so it's really important that if you're a city employee, please feel free to reach out and get some additional assistance. That, 1 hour session with question and answer may not be enough. And that also you don't have to struggle with figuring out how to handle it on your own. That everyone has a right to feel safe. Everyone has a right to have outlets for those outbursts as well. And so it may be that, when I'm on top of my family in the tiny apartment, I keep mentioning that I need to learn the tools. We've had to strengthen our tools for communication and being able to talk to each other frankly and honestly, which takes a lot of work, frankly, to be able to say things like, you seem really grumpy right now, and it's really affecting my ability to co-parent with you. Maybe you could go do something for yourself somewhere else, like outside, or in the back room. You could go do a yoga class, and then you can come back. And being able to be willing to hear that too is incredibly hard, but it takes a lot of communication and skills building. I feel like they need to do like special skills building tutorials for living very closely for very long periods of time, because we're not all used to that. We used to be separate a lot more than we are today. And so it's been important to really build our family skills as well.
So someone asked a question, the COVID experience has taught me to slow down and to delve into my being as to what is my purpose. And it's taught this person patience, taught them increasing their ability to listen, and also help them to slow down and think more about their next move in life. And I know that was one thing that I learned about, excuse me, resilience, is that taking this time to just pause and finding a way to find some purpose in this time it can be very helpful to us. Another thing about resilience that I learned is the way that we frame this experience that we are going through. If we can try to frame it in a positive manner, and see the supports and see the strength that we're building, will help us to continue to be well if we focus on the positive things. And so that's one thing that has helped me as well. Every morning I get up and I try to meditate and remind myself to be thankful to be here today, and just to continue to be working, because I know that not everyone has that has that opportunity at this time, 7 months in. And so see some more questions that are coming in. Uh, so would you like to share some more things about how to help family members, perhaps young children, parents with young children?
Yeah. Parents with young children in this pandemic. So the most important thing that, because we do a staff support hotline, and a lot of the calls that were coming in, sort of when things started settling down around June and people were feeling a little more like they could maybe get through it, people started saying, what do I do with kids? And one thing that came up and that they found very helpful was figuring out how to do breaks, because sometimes I remember talking to one counselor who said, I go to work all day and I am everyone's support network, and then I go home and I am my child's entire universe of social interaction. And so figuring out how not to be 100% for everybody is really important, and that's easier said than done and takes a lot of negotiation. I know people who've come up with physically distanced social play dates with their kids, where kids actually are pretty good at wearing masks. Honestly, like we find even kids who come into our hospital, they learn how to wear masks. They adapt to things because they haven't been doing something else as long as adults have. And so if you just keep saying for a few months, put your mask on or stop touching your mask, they eventually get it much more quickly than I do. And so being able to figure out, like, can they go to the nearby park and what is an activity they could do? Guess Who is actually something that a lot of kids have mentioned was a good game, because you're separated and you each have your own thing and you can play a game. And then kids like climb trees near each other in the park. That's something too. Outdoor parenting is really important in the city. I feel I mention my dog 7,000 times at all times, but when you have to walk your dog 3 times a day in the middle of the winter, it gets you really used to just bundling up and going out. And that is going to be really important to go outside even in the middle of the winter. I keep saying that masks will be really helpful because they'll keep us warm when it's really cold out. And it's just important to get outside, and sometimes the same family but in a different location is all that it needs to switch it. And then seeing people in a safe way, that a lot of times people get stuck in sheltering in that they're so used to just staying at home all the time. But we've learned so much since the spring, and we know about how it is safe to be. Walks in Greenwood Cemetery has been such a resource for a lot of New York City residents. And there are several other cemeteries all throughout the city that people can go for walks on with masks and walk several feet away. And you can have that social interaction. Your kids can have the social interaction, but you're also safe too, which when we say it out loud sounds really sad compared to what it used to be. But if it's that or staying alone in the apartment together, I love going outside and doing that.
So one question that we haven't gotten to throughout this talk that I really want to touch on before we end is, how does someone support friends and colleagues who have lost loved ones due to COVID-19?
And I think it's important to recognize that people are dying from other things besides COVID now too, because a lot of times I know that I've talked to colleagues whose family members passed away from cancer, other things that existed before COVID and are still going on, and they feel somewhat isolated by that, because it feels like unless it's COVID, it doesn't count somehow now, or people going through chemo or treatment for, I've had other health things come up since this whole thing hit. And so it's important to be, I feel like it's important to be brave enough to say what's going on so that I can share it with people. And then it's important for me, I found that I need to be a lot more emotive with my colleagues during this time that I'm used to. It's very different when you go by the water cooler and talk to someone. You're used to being more emotive with them during that moment. But then if I get stuck in emails all day long with people, it gets much more like, do this, do that. Thank you for this. Thank you for that. Okay, we're done. But if I'm more emotive in my messages to people, then I wind up having that that closeness with them anyway, so they're more likely to share it with me. And it's the same as any other relationship, where a lot of times it's just saying what's going on and then listening, and then just saying, that sounds really awful. Let me know if there's anything I can do, and I'm always here. And it's also important not just to be there right in the beginning. It's important to stick around, because lots of times people get a lot of sympathy right away. And then a few months in, they feel like they should be done with it and everyone else is not asking anymore. But that's actually when grieving is continuing, and that's important too.
Mm. Oh, that was all really great information. So I'm going to add into the chat section our resource link. And so you can please go ahead and click on the link, and you'll receive resources for this event. And I'd like to just move on, because we've answered a lot of questions, and this webinar again will be available to everyone who has registered. Perhaps tomorrow or Monday you will get it in your email. And I'd like to, we're not quite done yet. We'll have a lot of resource information that we will share with you. And so if there's no other questions, we'd like to just move on to that, because I want to make sure we touch on everything. So if you can just change to the next slide. So Rebecca, would you like to just tell us a little bit about H&H and the resources available?
Sure. Happy to. So H&H has 11 hospitals and 70 outpatient locations citywide. We don't have a hospital in Staten Island, but in every other borough we have at least one hospital. We provide psychotherapy and substance use services. We have behavioral health and primary care. We have medication-assisted treatment throughout the system for substance use, and we have primary care and medical services, and we have physicians, social workers, counselors, and peers. We have a wide variety of treatments available. We try to make it so that there's really no wrong door approach. If you come to one of our facilities, either our acute care hospitals, or we have several outpatient facilities called Gotham Wellness Centers, that really we want to hook you up with services there. And so all New Yorkers are welcome regardless of their ability to pay or present documentation. And we really are New York City's hospital system, so we're really happy to have you come through our doors. The phone number to call is right below, and our website as well.
Now, this has been a really wonderful event. Thank you so much for partnering with us. I've learned a lot. I hope that everyone on the call, on this webinar, has learned as well, and has had an opportunity to ask a question that they found out more and learned more about themselves through it. And so next slide, please. So you mentioned EAP, and I just want to just really talk more about EAP, because EAP, in my opinion, is an untapped source. You know, EAP, all the counselors on EAP are master's level counselors, and since COVID-19, they are still working very hard, and they have hours from 9 a.m. to 9 p.m. And so they are have extended hours, and they are offering support. So I say, if you have an idea, if you have a struggle, if you just need to answer a question related to mental health, not sure where to go, EAP is the right place to go. If they can't help you, they will point you in the right direction, but they definitely are there to support you in whatever way that you need them. And so please go ahead and contact them at the number that you see on the screen, or go ahead and email them as well. Next slide, please. And so Be Well, we are your mental health portion of your worksite wellness program, and we are happy to have brought to you today this information. We provide you with educational resources and wellness programming. And so if you find that you would like this type of work to be brought to your agency, please go ahead and contact us at the email that you see on the screen. We'd love to hear more about what you would need, or what you would need for your agency. And if you have any questions about supports, we'd be happy to answer those as well. Next slide. And resources for all New Yorkers. New York City Well is a great resource. If you go to their site, they have a lot of resources there for you. They actually supply you with a lot of links to different apps that you can use to help with meditation and other things that might be supportive to you during this time. And they also, and like I said, they're available to all New Yorkers, not just city employees. And they also provide services in different languages. So please take advantage of this service as well. Next slide. And Let's Talk. I'd like to tell you just a little bit about our Let's Talk campaign. Let's Talk is our campaign to eliminate mental health stigma in the workforce, in the City of New York workforce, by creating supportive workplaces and building resilience in employees. Our goal is to promote education, awareness, and knowledge about mental health at work. We are here to change the culture around mental health at work, and we'd love for you to pledge your support. If you're someone who is a mental health champion, you think that you understand that mental health is really important to you and your overall wellness, then we'd love for you to pledge your support. Persons who pledge your support, we ask that you reach out and support your colleagues, share information about these types of webinars and resources. And so please just join our pledge and our campaign, and we'd love to continue to provide you with more resources to help you in your work for overall mental health wellness. Next slide. And there was one more event today in the Coping and Caring series, and that's Color and Chill. Yesterday there was Paint and Relax, and today is Color and Chill. And so once you sign up for the Color and Chill event, you can either use your own coloring book, you can download one that we'll provide for you, and there'll be a great opportunity for you to meet new people on the Zoom call and just talk about interesting things that are on your mind while you are creative and relax. So it's a wonderful opportunity for you to end your day on relaxing and being creative. Next slide. So we have a few upcoming events. I'll go through them really quickly because I see we are running out of time. Next week, another Let's Talk event will be our workplace accommodations for mental health disabilities, and it'll be presented by the Mayor's Office of People with Disabilities. And you'll learn about what a mental health disability is, and you'll learn about reasonable accommodations. There'll be recommendations on how to have a cooperative dialogue with your employer. Sometimes we just need the language to be able to say what we need from work. And hopefully you'll be able to learn that on the next webinar next week. And in November, there's New York City on Matters of Race and Equality. It will be presented by the City Commission on Human Rights. So you'll learn more about what they do at the City Commission on Human Rights. And you'll also learn about the city's position on racial equality and policy changes and community outreach and the role of law enforcement. So that would be chock full of a lot of information. And Eat Well. Eat Well Q&A next month of November 12th. They will be talking about preventing and managing diabetes through nutrition. We have resident nutritionists, and they will be answering all your questions about eating well while living with diabetes and trying to prevent it. And so those, I'm sure you'll be able, if you are like me, you need some helpful hints, maybe not diabetic, but there'll be helpful hints to just learn about eating well. And so please join that webinar next week, next month. And then flu shots. They are giving flu shots out. We know that now more than ever, flu shots are really important for us to keep our overall health. WorkWell NYC has workplace, just a few workplace flu shot locations, but those are only open to employees. But you can go to the website. The website is noticed on your screen there. But you can also go to a participating pharmacy or your in-network medical office, and you can take your family there as well. So as long as they're dependent on your insurance, you can go to your pharmacy and network medical offices to get your flu shot. I think it's really important right now. We want to stay overall, we want to stay well. And I think the last thing is our coping and caring wall. And so I'm sure that you know more, about our we've had gratitude challenges over the years, and this is our digital form of that. So you can go to the coping and caring wall, trying to be able to pivot and make sure that we provide you with everything. This is a great opportunity for you to go to the coping and caring wall and share what's working for you, what's been helpful for you. And I'm sure you'll be able to learn what has been helpful to other people there as well. We'd love for you to reach out and learn and share with others. Next. So we'd love for you to stay connected. There's many ways to do that. Join our mailing list, follow us on Instagram, and follow us on LinkedIn. And before we finish entirely, we'd love to know how will you use what you learned today to help you build your mental health resiliency? So if you can just answer this question. That you will use what you've learned today, to help you build your mental health resiliency. So we'll just give you just a second more. Great. So it looks like 97% of you have found value in this webinar, and we're really excited about that. We're really happy that we were able to bring you this important information, and we are happy that you have learned something to help yourselves. And so, like I mentioned before, thank you again, Rebecca, Dr. Rebecca Lynn Walton, for partnering with us on this very important webinar, and I'm really happy to have been able to provide you with all this information. So thank you again.
Thank you all so much for being here and taking the time to be here today. I hope you all have a good rest of your day.
All righty, enjoy the rest of your day as well.